Thank you, Rosalind, for giving an opportunity to speak today. So you have heard so much about amyloidosis treatment, medical treatment and all, but I know amyloidosis, living with amyloidosis can be challenging, but I'm just going to focus on the self-care management, which you can manage yourself to control your symptoms. So it is simple, most of you might know, but I just want to go through it again, okay? Okay, so when the patient comes to the clinic, we normally say to the patient, you need to know what symptoms to look for. So as Mark already mentioned, and all the other all the other patients have mentioned, the most important symptom the cardiac amyloidosis patients will have is the shortness of breath. So like all the patients, they can identify themselves this symptoms of fluid overload. So some of the patients, they might be experiencing bloated feeling, because when the fluid is accumulated in the tummy, they feel like they don't want to eat. They feel bloated. And some patients, they might experience, if there is fluid in the lungs, at night, if they are lying flat, they might feel they are catching breath, they need to sit up. So that means there is fluid in the lungs. Or they might need to use extra pillows for breathing. So these are the symptoms which identifies fluid overload. So if that happens, you need to contact your healthcare provider. So if you identify any of the symptoms, you know that it's because of fluid overload. So we normally advise patients, one of the best things to identify, because we won't be able to identify this fluid building up, but the patients can identify this fluid building up if they check their weight at home every day in the morning before breakfast. So some of the patients might say, my weight is all the time, it's same. But for those patients, I would say to them, it's like checking the blood sugar for the diabetes. Even though the blood sugar is normal, you still need to check it, because you don't know when is the sudden change. So same way, if you're checking your weight in the morning before breakfast, write it down in the book, and over the 2 days, if you develop 2 kilograms over 2 days, that means there is 2 liters of fluid in your body. So if that happens, normally patients ring in our heart failure clinic, so we assess the symptoms and we give them the diuretic early, so that will prevent them admitting into the hospital. So most of the patients, they might say, I'm drinking only 2 liters, but how do you know how much you're drinking? So sometimes patients might say, weekends I drink 6 pints of alcohol along with my usual drinks. So each pint might be around 400 ml. So if you look at, just to give a measure of how much in each cups and each bottle of 7-Up, or wine, or the cups of coffee, it's nearly 500, 600 ml. So if you're drinking 2 or 3 cups of coffee and then alcohol 6 pints or 4 pints, that's more than 2 liters of that itself. So it's important to measure how much you drink. We don't need to write every drink you drink, but at least if you have filled a bottle in the morning, okay, I have drank that 1 liter. Now I have, maybe 2 or 3 cups of tea is my limit. So. And the other thing is alcohol. I know, alcohol, limited alcohol is good, but if the cardiomyopathy is caused by alcohol, we advise the patients to completely abstain from alcohol. It can increase the risk of arrhythmias, it can cause cardiac toxicity, it can increase the blood pressure. Most importantly, you can see the sugar and calories in the alcohol. So you can see the Mars bar, 2.5 Mars bar is in 1 bottle of wine. So, and how much sugar is in that. So, you won't realize how much harm it's doing other than the volume. So, just to give an idea. And the diet, we have heard from Smita, we have heard from Kathy, and yesterday there was a talk about diet. It depends upon patients. So, if we advise patients to eat healthy, we advise them to avoid all the processed food, if they have GI symptoms, if the amyloid deposited in the GI tract, we advise them to, they might have nausea and diarrhea. So we advise them to take small evening meal, longer interval between evening meal and the lying down. And we normally, when they come in, we normally get them to be seen by the dietitian, and they will give the nutrition supplement. And the salt. So 75% of the salt is hidden in the processed food. So normally patients will say, I don't use any salt, but most of the salt comes from the food. So surprisingly, like higher salty foods are here, like, the sauces, pizza and bread, sausage, ham, rashes, all canned foods. These are high in salt. So even like the recommended amount of salt intake is less than 5 grams a day. So if you think about, I think one slice of bread has nearly 1 gram salt. So if you have taken 2 or 3 slices of bread, for the day, it's gone, 3 grams is gone. So we normally advise patients to look at the food label and look at the salt content at the back. So if the salt is green in color, it's a good food to buy. But if it is orange or red, like if you look at any of the sausage, ham, rashes, they are high in salt. It's red in color. So that's the only way we can explain it to patients, to get the right food. And the medications, so Smita has already mentioned about her medications, vutrisiran and patisiran neuropathy medications, but mostly patients come to us, they might be on tafamidis, and you already know about tafamidis. It's once daily medication, and it doesn't have, much side effect, but we normally advise patients to get the blood test done every 6 months with the GP. And some of the patients might have, might be on the MRA, that's a mineralocorticoid receptor antagonist. That's the medications you might know the names of eplerenone or aldactone. So these medications are potassium-sparing diuretics. So we normally ask them to do, if we are changing medication in the clinic, we do them in 10 days' time. We repeat the bloods, but we advise them to get the bloods done with the GP just to know the potassium. And the other medications, other pillar of therapy in heart failure is Forxiga. That's Forxiga or Jardines. It's the SGLT2 inhibitors. So some of the patients might be on this medication. What it does is it takes out the glucose and the sodium from the body. So we normally explain the sick day rules to the patients. So if they are sick with diarrhea or vomiting, anything like that, we advise the patients to hold this medication because it might make them tired during that time. And also, because it takes out the glucose from the body, they can get thrush or, kidney infections very easily. So we advise them to look for any burning sensation or anything, and we ask them to report it to us. And the common symptom treatment is diuretic. As you know, most of the patients are on diuretic. They are on high dose. Sometimes in matter, we have higher dose, like one of the AL amyloidosis patient was 8 milligram 3 times a day towards the end. So she was on high dose of diuretics. So, it's very important to keep an eye on the weight and symptoms and checking the bloods as well for electrolytes. And the other thing is when the patients goes to the clinic, we normally advise them to bring the list of the medications. So most of the time, they might write it down, the dose might be wrong, or they might bring in the list which was prescribed initially. So, there can be plenty of errors. So normally we advise them to bring the medication boxes when they come to the clinic. So that is very handy. And also some of the patients, there is there is comorbidities. So we advise them, the families, to get a, pill box for them. Or if they are not able to manage, they can get the blister pack from the pharmacy. That will avoid, some of them might miss the tablet. So it's easier in that way. The other most important thing is some of the medications, if it is written for 2 weeks, they might think, okay, that's it. They won't renew it. They don't know, how to renew it. So it's always when the medication is finished, they need to get it renewed with the GP. So that's some of the health, self-care management, and it is essential for improving the quality of life. And it's not about managing symptoms, but it's about reclaiming control and living well with amyloidosis. So if you have any other questions, we'll discuss it here. Thank you.